I'm now pleased to introduce Dr. Leanne Riley, who is the United Head of the Surveillance Monitoring and Reporting Unit in the non-recommended Cervical Cancer Screening Department at the World Health Organization headquarters and leads the work on non-communicable diseases surveillance at the World Health Organization. Her unit has responsibility for global non-communicable diseases surveillance and key activities, including surveillance of risk factors for non-communicable diseases, patient and program monitoring for non-communicable diseases, and global reporting. Dr. Riley will be speaking to us about where we stand right now with cervical cancer screening around the globe. Dr. Riley.
Thank you so much, Karen, and good afternoon, good evening to colleagues around the world. It's really my pleasure to join in this exciting event to be moving the work forward. So I'm very, very happy to be with you today. I'm going to talk a little bit now about work that we have to look at the coverage of screening worldwide and the types of programs that are in place. You've heard from my colleagues that WHO and partners have launched an ambitious agenda to eliminate cervical cancer and set some highly ambitious but achievable targets for this work in the future. And you see them here on the screen, the 90, 70, 90 targets. I'm going to focus a little bit on the 70, which is the one we're really speaking to today, which sets a target for 70% of women to be screened by a high-performance test by 35 and 45 years of age. I'm going to talk a little bit about where we're at in the world in terms of meeting those targets. So as you have seen then, cervical cancer screening coverage is a key target for the Cervical Cancer Elimination Initiative. And understanding the status of cervical cancer screening programs is really going to help us moving forward to monitor the progress made in the initiative and with this target. So we have been pooling together the data, the coverage data, which comes from both administrative data in countries and population-based surveys to look at the extent of coverage, and have developed a series of country comparable estimates for the year 2019 in collaboration with ICO in Spain. We've also used this opportunity to look at what are the screening recommendations and primary screening tests available in countries. So let me just then share with you this map that highlights the lifetime screening coverage among women aged 30 to 49 by country compared across for a common year 2019. And what you will see from this slide is in terms of meeting a threshold for 70% of coverage among women, we are only achieving that for 76 countries, and 126 countries fall considerably below this threshold of 70% of coverage. And bear in mind, this is for a lifetime screening, not the 2 screens that are recommended by the target, but that are discussed in the overall target. In terms of numbers of women then, or percentage, if we're looking at the global figure, these new estimates show that only about 35% of women, eligible women in this age group around the world, have been screened at least once in their life. And there's a considerable difference if you look at country income status. So women in high-income countries are receiving a lot more screening access, 83% at least once in their life. When you compare it to lower and lower middle income countries, it's almost a tenfold difference. And this is, of course, something we really hope to see improvement on in the coming years. I mentioned that we'd also looked into the officially recommended primary test for cervical cancer screening, because as you'll recall from the target, it's not just about receiving screening, but it's also about being screened using a high-performance test. So this is something that we're also wanting to track. So this map shows the countries in which where the type of screening is covered, with the dark blue showing HPV testing for screening, a mixture when you see the lines, and the green for VIA. And so in our analysis of this, we've found that 69% of countries have an identifiable official recommendation for cervical cancer screening, so that's the good news. 34% are now recommending primary HPV-based screening, but most of these are still transitioning or mixing it with other forms of primary test. And most of those countries are in the high or upper middle income bracket for countries. So Pap smear is still the most widely used screening test. 78% of countries are using it either alone or combined with other tests. And we have 29% of countries who are still recommending VIA as testing, and that's mostly in low-resourced settings. So in conclusion then, globally, only 35% of women aged 30 to 49 have been screened at least once in their life. So that's a massive 2/3 of women who have not yet been done. And we see this vastly unequal distribution of screening coverage by the country income level. So we're quite far at this point from achieving the target of screening coverage with a high-performance test by 2030. And that's particularly the case in regions of the world where we face the highest burden of cervical cancer. So that's absolutely something that we want to focus on in the coming years. And then just finally, monitoring this kind of progress, looking at where there are recommendations, the type of test being used and the screening coverage. This is really going to be critical to us being able to monitor the success of the elimination strategy. Thank you so much.
Thank you for setting the stage for us, Dr. Riley, about where we are now with cervical cancer screening. It certainly allows us to gauge our energy and certainly offers us a challenge to moving forward to meeting the 2030 goals of screening 70% of eligible women. And now we'll move into discussing how we can move forward to reach these goals. In order to discuss the launch of the new International Agency for Research on Cancer Handbook on cervical cancer screening, we are honored to have Dr. Elisabete Weiderpass. Dr. Elisabete Weiderpass is the director of the International Agency for Research on Cancer. She is a medical doctor and scientist with expertise in cancer epidemiology and prevention, and is a visionary leader coordinating the agency's work on the implementation of preventive strategies for cancer control. A great deal of IARC's work is being dedicated to improving cancer control and prevention in low and middle income countries. Dr. Weiderpass.
Good afternoon and good evening to you all. My name is Elisabete Weiderpass, and I'm the director of the International Agency for Research on Cancer of the World Health Organization. We are based in Lyon, France. Up to 40% of new cancer cases could be prevented by adopting healthier lifestyles, including cancer screening. This is why I'm particularly pleased to be here today for the joint launch of the results of the International Agency for Research on Cancer Handbook meeting on cervical cancer and the WHO recommendations on screening and treatment to prevent cervical cancer. I'm very proud to introduce Dr. Béatrice Lobby-Secretin, head of the International Agency for Research on Cancer Handbooks on Cancer Prevention Program. The Handbooks of Cancer Prevention are a flagship program of the IARC. The scope of the program to conduct definitive evaluations of the potential of specific agents and interventions to prevent cancer aligns fully with the International Agency for Research on Cancer's mission and the new medium-term strategy. Close collaboration with WHO is a cornerstone of IARC Medium-Term Strategy 2021 to 2025 and the Handbook on Cancer Prevention, Volume 18 on cervical cancer screening was developed jointly between IARC and WHO headquarters. IARC's work is critical for WHO. Research conducted by IARC provides an evidence base for cancer prevention that is readily translated by WHO into advice and policy recommendations to member states. This handbook creates the perfect bridge between evidence-based research and the WHO normative work. Similarly, the next volume of the handbook on oral cancer prevention is now being co-designed between IARC and the WHO Regional Office for Southeast Asia, or CEARO. Congratulations on this joint work, which is extremely important for women around the world. Beatriz Secretan, the floor is yours. Thank you.